I'm excited to welcome Colonel Susan Moran, Command Surgeon of U.S. Southern Command, as she will be leading us into the highly anticipated Fireside Chat with Dr. Anthony Fauci. This panel is hosted in conjunction with U.S. Southern Command's Global Health Security of the Americas Conference virtual speaker series. Welcome, Colonel Moran. The floor is yours.
Brian, thank you. We too are very excited about today, aligning our monthly Global Health series with FIU's 6th Annual Hemispheric Security Conference allows us an amazing opportunity to bring together subject matter experts from across the globe. This interdisciplinary whole-of-society approach to tackling COVID is critical to restoring security throughout the hemisphere. Before we get started, I want to send a special thank you to your team at FIU for providing today's IT support. And another special thank you to our neighbors in Central and South America and the Caribbean that have joined us today. It has been a long year and a half. This is especially true for the Western Hemisphere, which has been disproportionately hit with COVID. As the World Health Organization has noted, 13% of the global population lives in our neighborhood. Yet the Americas account for 40% of global cases and 48% of global deaths. This pandemic has had a devastating impact on Latin America. Our partners are not alone. There is no doubt that COVID-19 has changed our world on every level. We have each personally and professionally been impacted. The medical, political, and economic challenges we face are not unique to a certain country. We are fighting this battle together. So today, as we learn together, we are honored to host Dr. Fauci, America's trusted voice throughout the pandemic. Recognizing the unprecedented waves of COVID currently impacting our partners, today's Fireside Chat will specifically focus on our regional approaches to address this ongoing threat. To start us off, I'd like to introduce my boss, Admiral Craig Fowler, Commander of United States Southern Command. Sir, I've appreciated from the onset that you have recognized that COVID is a global challenge and you have committed to a global response. Sir, the floor is yours.
All right, thanks. And I know that we're actually waiting to hear from Dr. Fauci, but just a few words of thanks to FIU and to you, Susan, who have led our charge here at United States Southern Command. So greeting to all of you, all of in our great neighborhood of the Western Hemisphere. I think the last year has proven that all problems that we face, national security challenges, are global, and the pandemic demonstrated that in just time and time again, that we are all in this together, and the only way we are going to solve this is together. From the beginning, we recognize that here and use these virtual platforms to connect with our partners. And no one, I would say, is satisfied with the speed of response. Nobody got anything fast enough or early enough, but we tried our best to stay connected with you all with some 500 projects totaling nearly $73 million that we did here from Southcom and Miami in 28 partner nations. So our span is from Guatemala and South Latin America out and into the Caribbean. And this week, we know everybody waits vaccines, so we're very pleased to see the president's announcement. And I know our partners look forward to that, and the U.S. will continue to lead the way. And by the end of June, I think we'll be in the tens of millions of vaccines supplied globally. So this year is a heck of a year, and it was good to have a trusted someone that really built trust from our perspective. Dr. Fauci, we talk about trust with our partners, our neighbors, and build that trust on an individual basis, a personal basis, mill to mill. We recognize that health security is national security and global security, and no one for decades has led the way better than you. And I would just say on behalf of all of us, thank you for being that trusted face on the evening news, the morning news, the nightly news, around the clock. We banked on your information day in and day out and passed it on and acted on it as fast as we can. So without any further ado, Dr. Fauci, from all of us, thanks and welcome, and thanks for addressing the audience today.
Thank you very much, Admiral Fuller and Colonel Moran. It's really a terrific pleasure to be here with you today and to participate in this fireside chat. As you know, we feel strongly about our collaborations and cooperations with the region of Latin America, the Caribbean, and South America. NIAID, as you probably know, has been supporting about 357 projects in 24 countries. So I know what you mean when you say we're all in this together, both from a research and a public health standpoint. And as we all hope, and I believe it will occur, and I believe it will occur within a reasonable period of time, that we will get through this together since we've been in it together. And as Colonel Moran said, unfortunately for us, we have suffered very, very dearly through this in our part of the world. But we're seeing the light at the end of the tunnel, and I look forward to the upcoming discussion so we could talk a bit more about that. So thank you so much for having me. It's my pleasure and privilege to be here with you. Thanks.
Thank you, sir. As Admiral Fowler expressed, it is indeed our honor. I'd like to start our discussion by focusing on the collective way ahead. Across the world, we are seeing countries where deaths are at their lowest level and other countries struggling under a devastating wave of deaths. With focused efforts to increase vaccine production globally, we understand that sufficient supplies to meet the world's needs will take time. Researchers at Duke University, for example, estimate 11 billion doses are needed to vaccinate 70% of the world population, with roughly about 2 billion doses produced to date. So while we would all love COVID, the threat to go away and end tomorrow, my math just doesn't seem to get us there, that it will happen tomorrow. Recognizing the global audience, where do you see the world headed this next year with COVID?
Well, it's going to be a mixed bag. What I see is what we're already seeing right now in the United States, where we have just now over the last few days reached 60% of our adult population has received at least one dose. We hope, as the president has made a goal, that by the 4th of July, we'll have 70% of the adult population receiving at least one dose. We're going to be seeing similar situations in other developed nations, but by a mixed bag, Colonel Moran, what I mean is that there are many countries, including India, for example, who has about 3% of their population fully vaccinated and only about 10 to 11% having received at least one dose. So the challenge is going to be, as the developed world continues to vaccinate a greater proportion of their population, we're going to see places like South Africa, places in South America, including Brazil and other South American countries, as well as certain countries in Asia, struggling to get their population fully vaccinated. The way to that goal would be to have, as Admiral Fuller said, this is a global pandemic with a global problem, and it can only be solved by a global solution. So I would think that we would have to, as an area of the world, together with other developed nations that have the resources and the capability to take care of our own, we do have a responsibility, and I would think it was a moral responsibility, to pull together and make sure that we get doses of vaccine in an equitable manner to other areas of the world, and not wait the 2 to 3 years that it would take to get to the math that you were referring to. Your math is quite correct. We're not going to get there soon if we don't do something different than what we're doing now. So that's what I mean by it's really a mixed bag, and we've got to see if we can make equity a very important goal of everything that we do.
Yes, sir. So we completely agree with you on the equity and the need to support globally, and the ownership that the United States can take in that front. As we talk about this, you hear the words out there, pandemic and endemic, and people talk about, well, COVID-19 is here to stay, like the flu or the common cold. Can you explain that in kind of, as we always say around our headquarters here, ship driver simple language? What does that mean for COVID-19 being here to stay? And how does that transition from a pandemic to an endemic even happen?
Well, when we talk about infectious diseases, there are 3 outcomes when you have a highly communicable disease like COVID-19. There's eradication, elimination, or control. We have only eradicated one single pathogen for humans in the history of our civilization, and that's smallpox. And we've done it with vaccination. We, however, have eliminated several, such as polio in the developed world, measles in the United States, other diseases that are not eradicated, but they're of no consequence whatsoever. And then there's control. And when you talk about COVID-19 being with us forever, what people are referring to is we may not be able to eradicate it, and we certainly might not be able to completely eliminate it. So there are no cases in the United States. But what we are hoping for is very, very good control, where it no longer is pandemic or epidemic, but if at anything, it's just a very low level when most of the population is vaccinated, that you would get an occasional case here and there that's a breakthrough case. I think that's the goal we should be going for. If we reach elimination, all the better. But we've got to strive for very strict control of this infection.
Yeah, that sounds great. And I think it sounds like a where we're all hoping to be in the near future. But how do we get from where we are today to that control? What are the driving factors that would get us there?
Vaccination, vaccination, and vaccination. That's it. I mean, it really is as simple as that. We have been fortunate enough that we have a highly, highly effective series of vaccines, not just one, that if we vaccinate the overwhelming proportion of our population, we can get to that strict control that I talk about. Short of that, when we're not there yet, we've got to maintain the public health measures that we've been talking about now for well over a year. And we should not declare victory prematurely until we do get that rather strict control of the outbreak.
Yeah, completely in agreement there. So vaccines, shots in arms as quick as possible. The US did a phenomenal job, 350 million doses distributed in just 5 months. As we look at that, my understanding from where I sit is that was a whole of government interagency response to get us there, roping in every agency to get us to that point. But I'm not the expert, you are. So I'll ask you the question, how did we get there? Did we have, I think a lot of times our partners look at us and say, the US, you must have had all of this put into place before the COVID happened. It must have been easy for you to roll out this number of doses. Is that true? And if not, what lessons learned would you say that the US has from the vaccine distribution that we can share with other countries that may not be at the same place that we are today?
Well, we certainly didn't have everything in hand ready to go. The only thing that I believe is the real success story of this was the investment in basic and clinical biomedical research, which allowed us, we always get asked, how could it possibly be that the virus was first recognized in January of 2020, and 11 months later, you had a highly effective vaccine going into the arms of individuals 11 months later in December? Well, it didn't start on January 2020. It started decades before with fundamental basic and clinical research leading to platform technologies like mRNA, as well as the structure-based vaccine design of immunogens such as the highly immunogenic spike protein. The issue of public health preparedness was a different story. And that is, even though we were judged by, for example, the Hopkins School of Public Health as being the best prepared nation in the world, obviously, when we hit the ground running, it was very clear that things were not going as well as we wanted to. And I've learned from my military colleagues who tell me you can plan for a battle, but when the guns start going off, the fog of war sets in, and it's really not very easy to get on the right path. But I believe we're there now. You can make a lot of metaphors of it. We started off, we got hit very badly. So if the early part of the outbreak in January of 2020 was Pearl Harbor, the Battle of Midway has now been won, and we're on our way to victory.
Appreciate the wartime references there. And as you state, it wasn't a smooth, we definitely had some challenges along the way, those pieces. I appreciate too, you saying that it wasn't just 5 months of work, right? It might have been 5 months of vaccine distribution, but many, many, many years of strong scientific background to get us to the point of where we had safe and effective vaccines, an incredible amount of industry work done on the development and the distribution plan, just watching from my perspective where I sit, watching the systems that were built for tracking and administration and just distribution, those logistics have been pretty phenomenal to watch. As a pediatrician, I know that in the US, we don't have a centralized immunization registry and some of those types of things. So for where we came, just kudos to the entire team that got us to this point. As we look forward though, it's one thing to get shots out to the locations, to the pharmacies, to the mass distribution lines. But the next piece is getting those people to show up. So as we look at vaccine hesitancy, I think across the globe, we struggle with that trust factor. And so what lessons learned would you share from a US perspective to our partner nations that are trying to build vaccine confidence?
You know, that's a very good question, Colonel Moran, and it's really complicated because people have different reasons for vaccine hesitancy. Some is just that they really want to learn more and feel that they need to wait and see what goes on. We, as you said now, have administered hundreds of millions of doses. So wait and see is getting a little old. So because we really know what's going on. So it really has to be a situation of treating people who are hesitant, not in a finger pointing manner or in an accusatory manner, but try really to understand why they're hesitant. And we've developed, you know, the COVID community core, which is a group of trusted messengers that people can rely on and trust. They could be sports figures, entertainment figures, clergy, or even your family physician, to reach out to people to try and answer the reasonable questions they have about why they may want to be hesitant. And I think as we get into the home stretch now, you know, we're at 60%. We want to get over 70% by the 4th of July, which means we need to keep up the pace of the vaccination. So this works for us in the United States. I think it will be equally applicable to our colleagues in different countries, in the European Union, in the UK, and other places where they are also experiencing vaccine hesitancy.
Yeah, absolutely. So first listen, right, and understanding those pieces. But I do appreciate how we have used leading figures, people that they trust, pastors in communities, sports figures, et cetera, to help get that message out. One of our fears, of course, is, and I know your fear has been as well as General Perna, is we get doses out to locations and then do people show up? And of course, nobody wants expired doses along the way and wasted doses. So thank you. As we shift kind of from vaccines to talking about preventative measures, you mentioned how important those pieces will be going forward because we will not have enough vaccines immediately to end the pandemic. But in our countries, we look at the challenges that are out there. And as due to the economic impacts, as folks try to move from lockdown modes to opening back up, especially to tourism or to other businesses, what measures are the critical key ones, and how do you strike that balance?
Yeah, the balance is going to be, you know, as I said a moment ago, importantly, obviously, the number of people who are vaccinated and the level of viral dynamics in a community is going to dictate pretty clearly what you can and cannot do. One of the things we have to be careful of, because we've gotten burned and other countries have gotten burned before, is to declare victory prematurely and to just open up completely without any plan for how you're going to handle any even small resurgences of infection. So, I mean, we always talk about things like mask wearing and physical distancing and things. You can gradually open up without just throwing aside all public health measures, because if you still have a considerable amount of viral dynamics in the community and you just pull back on everything all at once, that's going to turn out to be a problem. So the advice we give, if you want to call it that, is to be measured in how you pull back from public health restrictions and not try to do it all at once, because time and again, we've gotten burned when we've done that.
Yeah, measured, gradual. Um, those of us on the medical side, we keep reiterating that. It's hard, right? Because there's a lot of pressures on the system. But we watch what's happening in our hospital systems, as many of our hospitals, both here in pockets of the United States and of course throughout our region, throughout Central and South America and the Caribbean, where our hospitals are just bulging, right? They're surging. Those medical teams have been sprinting a marathon for a long period of time. They've stood up mobile field hospitals, and they're doing everything that they can to try to manage the patients that are there. As supply challenges do continue in some areas, moving forward, besides vaccines, do you have any other advice for building resiliencies in our global healthcare system?
Yeah, one of the things that we haven't mentioned that has lagged behind the successes of vaccines have been therapeutics, because as people get infected, people are still going to get sick. They're going to advance, requiring hospitalizations, some of them requiring intensive care. We have pretty good therapeutic approaches learned through experience about advanced disease. What we are really putting a major effort on, and hopefully similar to the results that we got back with HIV/AIDS when we developed a number of direct antiviral agents that really transformed the lives of HIV-infected individuals. And the same with hepatitis C. We have curative therapies now in an 8 to 12-week regimen, that if we could get a few drugs that directly block virus replication, that you could immediately treat in an oral regimen for people who begin to get symptoms, hopefully we can avoid the progression to hospitalizations, which we see in so many people. You know, this is a very puzzling disease. So many people, the overwhelming majority, they do very well. They get infected and nothing happens, minimum symptom. That same virus goes on to kill other people. It's really a mystery, the likes of which I've never seen before as an infectious disease person.
Yeah, and if you haven't seen it, that says something, right? Yeah, it has been very challenging to predict, right? Which of those patients will succumb and which will not, despite the science that we do have. There's still much to be learned. As we've talked just now about the gaps in therapeutics, also want to see in our final minutes too, if we can touch on what you see as the gaps in global health security. So President Biden's national strategy talked about expanding our defenses to predict, to prevent, and to mitigate biological threats. As we work globally together to improve biosecurity and biosurveillance, where should we be focusing? And what critical systems do we need to put into place, either at the country level, regionally, or globally?
Yeah, I think globally is the issue, Colonel Moran. You know, before all this happened, we went into what's called the Global Health Security Network, or the Global Health Security Agenda. And really what that is to have an interconnectivity of nations throughout the world that in real time can communicate, can share data, can have a surveillance system that's completely interconnected. I don't think that we can stop the emergence of new pathogens. That has occurred since the beginning of civilization, before we could even record it. But what our job is to prevent a new emerging pathogen from becoming pandemic. And that I think we can do. And you got to have things in place like pandemic preparedness of pathogens that you already are ready to hit the ground running in making a vaccine. You got to have surveillance that's as exquisite as our best intelligence that we have in the military to have defense against a real warfare attack. We've got to do that because we really are in a war with pathogens. I mean, if anybody looks at what we've been through in the last 15 months, it's equivalent to being at war. It really is. It's a wartime footing. So we have to treat it in preparation like it's a wartime preparation.
Yeah, absolutely concur. And we use that reference here all the time and talk about how we are at war with COVID-19 and how COVID-19 has a say in everything that we do operationally on the Department of Defense side. It has been good to see the refocus on the global health security agenda. And we, from our perspective, stand by to really have a whole of society approach to improving global health security, because we understand the importance of the different governments coming into that, as well as the researchers and the roles that our non-governmental organizations, our academics, our researchers, that we can all stay focused together, the difference that we can make moving forward. I want to ask you one final question before we go, and I know this is the question on everybody's mind, but as we talk about global health security and we talk about vaccine distribution, it was welcome news this week for President Biden to reaffirm his commitment to those important programs, and to leading an international effort and a coordinated effort. And we were welcome to hear that 13% of the US vaccine production would be available to our partners across the globe by the end of June. Is there anything that you can share in addition to us, with us, in addition to what we've seen in the news?
Yeah, that's exactly right. It's going to be 60 million doses of the AZ that we have, plus an additional 20 million doses combined of Pfizer, Moderna, and J&J. That's for a start. So what we're saying is that would equal that 80 million to 13% of everything that we are putting into the arms of people in our own country. There will likely be other negotiations later on about how we can help other countries to make their own doses, namely to do the kind of technology transfer in partnerships with the pharmaceutical company to allow us to get more doses into the arms of people, in addition to the 80 million doses that the president was talking about.
Sure, thank you. I want to just reiterate what we said in the beginning. I want to thank you for your time. I know your time is very, very valuable, and we know that you have to rush back to the White House and to other additional meetings at this point in time. But thank you for sharing your expertise with us. Thank you for helping us understand that this battle will not end tomorrow. And although we have won and lost some individual little battles along the way, that there is light at the end of the tunnel, that we are making strides and improvements, and globally working together, we will get to that next piece. I'm going to hand it over to Ambassador Maines, Admiral Fowler's deputy, for some closing comments.
Great. Thank you, Colonel Moran and Dr. Fauci. What a privilege it is to have you here. I can't tell you how many times in our command where information was spreading, we would go back and ask the question, what did Dr. Fauci say? And that was really our benchmark all throughout the past year. So just know that your trusted voice has meant so much to all of us, including our partners. And online today, we have ministers of security, ministers of health, public health officials, people really who've been on the front line all throughout the pandemic, just like you. And we want to say thank you to them. So on behalf of U.S. Southern Command, Florida International University, from all of us, thank you for all you've done. And as we lead through this next phase and we go into increased vaccine distribution, we really are committed to the entire hemisphere. And just know that we won't stop until the entire hemisphere is secure, because health security is absolutely national security. And now I have the great privilege to carry on a military tradition and present you virtually with the U.S. Southern Command coin, Dr. Fauci. So virtually, here's our coin, and I'm assured that it's in the mail. So again, thank you so much for your leadership of our nation and globally as we've gone through this pandemic together.
Thank you very much, Ambassador. I appreciate it. It's good to be with you. Thank you.
Brian, over to you.
Thank you, Ambassador Maines. I want to thank you, Admiral Fowler, Colonel Moran, of course, Dr. Fauci, for an excellent discussion. I can't tell you how important our partnership is with Southcom, and the relationship that we have is so meaningful and I think impactful, not just in our immediate community, but the broader community across the Western Hemisphere. And so I'm really delighted that we have this opportunity to partner, to converge in our programming. And so again, I'm really grateful for the work that we get to do together. I want to thank all those on Zoom and webcast who joined us from around the world for day 4 of the Annual Hemispheric Security Conference. We're back here at 11 a.m. tomorrow morning for a panel on the future of the Amazon, led by the Council of the Americas. And so with that, this concludes day 4. Thanks again to all who joined, and I look forward to more great dialogue tomorrow.